Hi guys, let's continue our journey with growth and development of cranial and facial region. Today let's see the growth and development of mandible in a little detail. So let's include our contents under the following heading. One is prenatal development of mandible, postnatal growth of mandible, the applied anatomy and treatment protocols that are usually followed. To begin with the prenatal embryology of mandible, the mandible has its origin in the intrauterine life from the mesial condensation of the first pharyngeal arch. So here is how it is illustrated, in which this embryo is around the 36th week, in which there is mandibular process, the maxillary process towards on the superior aspect, and the derivatives of maxillary process such as frontal prominence with the opening towards the future mouth, that is stomodium, is being illustrated. To begin the journey, let's see how the development of mandible takes place. So earlier we have discussed and studied types of bone formation in growth and development. So we have two kinds of bone development. One is endochondral bone formation. The other is the intramembranous bone formation. Now, endochondral ossification or endochondral bone formation involves a precursor of cartilage, which is being replaced by a bone eventually. So, mandible is also on the same note, has got a precursor called as a Meckel's cartilage, which paves the way for the development of the mandibular bone in future. So this Meckel's cartilage tends to be derived from the first brachial arch during the time of 4th to 45th day of intrauterine life. Then it progresses through the optic capsule and lays its foundation for the future mandible. Moving on to which we have the ectomesenchymal condensation around 36 to 38 weeks of intrauterine life, which highly lays down the Meckel's cartilage, but it vanishes over the resulting intramembranous bone that vanishes this endochondral bone formation eventually or just before birth. So the prenatal embryology of mandible hints us the mandibular growth is happening between 8th to 12th week of intrauterine life, in which the Meckel cartilage persists and disappears gradually. So as long as 24 weeks it remains and gradually disappears in course of deposition of new bone or intramembranous bone growth, which sets the tone for the growth for mandible. Now moving on to the endochondral bone formation has got three main areas of mandible. So the growth is contributed from the condylar process, the coronoid process, as well as the mental process. To see in a little detail, let's get back to the embryology of the cartilage, the prenatal embryology of coronoid process, condylar process, and the mental process. To begin with, during the 5th week of intrauterine life, there is a mesial condensation that is happening to the ventral surface of the Meckel's cartilage, which around 10th week develops continuously into a cone, and about 4 months it migrates and fuses with the ramus. Now moving on to the coronoid process, the cartilage eventually expands and combines or it grows in terms to intramembranous bone and just disappear before growth. Now the mental region are formed by the mental ossicles, which also is replaced by the intramembranous bone once a fully developed mandible is formed. Now looking on to the postnatal development of mandible, let's assess the growth of mandible or the changes that is happening to mandible in terms of various parts of mandible that is having a change in shape, size or proportion or its relation to the adjacent structures. So let's take few processes or few components of mandible into special consideration. So these include, first let's focus ourselves onto ramus. So the ramus grows posteriorly and then it drifts the growth in the anterior direction. So here there is the process of remodeling in which deposition is happening posteriorly and resorption is happening anteriorly. So the slow drift in the ramus is a consecutive is a culminative factor for the growth of mandible. So lengthening of the ramus also plays an important role in setting the overall length of mandible. Now moving on to the angle of the mandible, how is it different? The angle of the mandible has posterior bone deposition and on the buccal aspect there is continuous resorption. So that's why it is a posterior inferior aspect of deposition which has been noticed when considered to angle of the mandible. Moving on to, let's focus on to the lingual tuberosity. So the lingual tuberosity tends to get thickened or the growth is more pronounced posteriorly facing the posterior surface. So moving on to embryology of mandible in dealing with alveolar process. The teeth generally erupts from the alveolar process in which it increases its bone height due to the eruption forces. So the alveolar process also adds on to the height of the overall growth or the height of mandible. And it also brings about the thickness of mandible as there is resorption and deposition of bone taking in and around each socket. Moving on to which we have the condylar process which plays an important role in development of mandible, positioning it and directing the growth of mandible. So there was two schools of thought regarding the condylar process development. So initially or the first school approach was how the surface condylar cartilage is formed by bone deposition, not by any other factor. So this was the first approach which was further modified in the second approach, and it is currently accepted approach that the growth of soft tissues including the tendons, ligaments, the capsular ligaments and the other connective tissues surrounding it carries the mandible or places it much forward away from the cranial base. So this theory is accepted widely than the old school of thought. Moving on to which the postnatal embryology of coronoid process is about the enlarging V principle in which there is deposition or thickening of the ends of V and resorption on the anterior aspect. So when you see it, posterior aspect of coronoid process tends to grow at a faster rate than compared to its anterior regions. So this is how both left and right coronoid process help in the overall growth and development of mandible. Moving on to the applied anatomy or the anatomical aspects, let's move on to mandibular prognatism. What is mandibular prognatism? So it is a pathological condition that is genetically defined in which the lower jaw is outgrows the maxilla and it results in extended chin. So overall, the mandible tends to be a head of maxilla and it is placed forward when compared to the upper jaw. So the treatment protocols that is generally fulfilled will be a combination of orthodontics and surgical procedure to push the mandible backward towards the maxilla, or a removable appliance used like a bite splint or a chin cap is advised. However, it just depends upon the degree of separation or the amount of movement of mandible ahead of maxilla. So the growth and timing of each individual can be different and the positioning of mandible ahead can also vary from one person to the other. Now let's see another condition which is just opposite to this. It's called as retrognatism. in which the mandible is placed behind the maxilla, and there is a type of malocclusion that is happening here. So, in which the maxilla is placed ahead and the mandible is placed much lower end. So, in this, it results in a facial skeleton which is highly deformed. In this aspect, a mild retrognathia can be left untreated if it doesn't cause severe problems. But if it's a fully grown cases, when there is severity, it has to need an orthodontic correction and a surgical approach towards it. So we have the face mask therapy that is advised under the orthopedic consultation as well as the orthodontic consultation that regulates the growth of mandible. So it helps in bringing the mandible a little more forward in positioning in accordance with the upper jaw. So here we conclude this session of development of maxilla and mandible, as it gives us a note on treatment planning, on diagnosing and future inheriting the problems that is facing in our day-to-day clinical life. So the orthodontic treatment has to be planned well ahead of time, keeping the age of the person in mind as well as the growth spurts and the gender of the patient. So all the factors plays an important role in determining a success of the orthodontic treatment. Thank you.